If you support families with infant feeding as a lactation consultant, SLP, therapist, doula, or other provider, you won't want to miss this. I'm Lisa Paladino, certified nurse midwife and IBCLC, and I'd love to invite you to my free 3-day video training. Why tongue tie is missed and how you can learn to spot it with confidence. In just a few short videos, you'll gain the clarity you've been craving around tongue tie, what to look for, why it's often missed, and how you can better support the families in your care. It's free, flexible, and made for busy professionals like you. Sign up now at tonguetieexperts.kit.com/free. That's tonguetieexperts.kit.com/free. The clickable link will be in the show notes. I'll see you there. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Paladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. Hello, welcome back to the Tongue Tie Experts podcast. I'm your host, Lisa Paladino, and today I am thrilled to introduce today's guest, Dr. Piya Gandhi, a dedicated pediatric dentist with a passion for airway health and oral function. Practicing since 2009, Dr. Gandhi completed her pediatric specialty training at the University of Texas in Houston and brings a wealth of expertise to her patients and the professionals she educates. As both a dentist and a mom to 2 wonderful daughters, Dr. Gandhi understands firsthand the importance of whole body health. She specializes in airway development and the diagnosis and treatment of tethered oral tissues, routinely screening her young patients for oral restrictions that can impact growth, development, and sleep. Beyond her practice, Dr. Gandhi is a sought-after educator, collaborating with professionals and lecturing nationally to improve awareness and training in airway disorders and tongue ties. She's passionate about empowering both practitioners and parents to make informed decisions about children's oral health. When she's not transforming little smiles, Dr. Gandhi enjoys traveling with her daughters, practicing yoga and Pilates, and cooking up new culinary adventures. Get ready for an insightful and engaging conversation. Thank you for being here, Dr. Gandhi.
Thank you so much, Lisa. I'm excited to be with you guys today.
Yeah, and you know what? We have such a similar mission-based practice. My practice is different than yours. Obviously, you're a dentist. But I love hearing the whole body, full body health. That's your passion. And not only doing what you do, but educating others to do. So I really, when I first heard you speak, I knew that I had to have this deeper conversation with you because we share so much, but yet we have different paths.
Absolutely.
So, yeah. So one of the things that excites me about what you talk about is, you know, we've been talking about tongue tie, but that airway issue, the airway about tongue tie. Talk to me about how that started to connect for you.
Yeah. So when I started off in this field, it was just tongue tie. That was the first kind of education point that I had. It was also the place where I started because that's where I struggled with my own daughter, was on the kind of tongue tie breastfeeding journey. And then quickly, you know, in my practice while I was treating these tongue ties, you know, there were clearly missing pieces that I was not getting, because the tongue is part of a whole body system and a whole oral facial complex. And so, you know, we can't just isolatedly look at the tongue. We have to look at how the tongue function dictates the growth of the upper and lower jaw, what it does to breathing and sleep. And so that quickly took me on a deeper journey and realizing that the tongue tie piece is just one piece. It's a very important piece. And in my opinion, one of the biggest reasons to treat a tongue tie during infancy is to support proper airway development. So we have to be looking at the tongue tie, but we can't only be looking at the tongue tie. And I think there are still practitioners out there, which I'm just glad practitioners are looking at tongue tie, period. But I think that some of them are still getting in the hole of just looking at a tongue tie and not looking at a whole head or a whole body, because it's all connected. You got a tongue tie, it's affecting your breathing, it's affecting your posture, it's affecting your diaphragm, it's affecting your sleep, which is affecting your hormones. I mean, it's everything. Mm-hmm. So, and it's a journey to get there, to be able to look at all of that. I certainly didn't start there. Like I said, I started just looking at tongue ties, but then I had the realization. And when I teach other practitioners, I think it can be overwhelming to look at my practice that has the chiro and the myo and the lactation, everything in it already, and say, well, I'm sitting here by myself. How am I going to get all the way there? Well, it didn't happen overnight. It mm-hmm. happened over 8 years mm-hmm. and it's still happening. We still are evolving and learning. But I think just knowing that I can't just look at one little piece. Similarly, we now have some orthodontists that look at airway, but a lot of them don't understand the soft tissue piece and the body piece. So I think the knowledge of understanding that there's more to it than just the airway or the jaw structure or the tongue tie or the nervous system, we have to realize that in order to get all these pieces, you don't have to treat all of them as an individual. You have to be able to assess them and then partner with people, because that's how we get the best overall functional results.
Yeah,
and better health.
I totally agree, and do see that possibility of overwhelm when you think, mm-hmm. wow, I have to be able to do all of this. I just thought I was buying a laser and learning right. how to help babies breastfeed. And then you start putting the pieces together. And especially with older children too, you start seeing older kids and looking back on their history and their feeding history and their sleep history and realizing that it's all connected and we don't exactly understand everything yet. Right? There's so much research that's still being done, but I don't think anyone can go wrong when they look at a person, a patient in front of you as a whole instead of just the part you're treating. Yeah. And understand that there are people who do understand how to treat the other parts that you don't know.
Yes, you certainly don't need to be an expert in all of it. You just need to know who to refer to and what the problem is. I also think treating infants is still not simple, but it is the least complicated generally, because we haven't had the chance to have the negative impact on all the other body systems as much. So we're still in growth phase. And even though for infants, we do lactation and chiro and sometimes PT and osteopath, there are still lots of other components, but it's more from a preventative standpoint, but also from a, yes, we're seeing some impacts, but we're still moldable and the body is still growing and changing so much that we have lots of opportunity to guide that growth. Mm-hmm. So I think from a practitioner standpoint, treating infants first, if you're starting out, is really the best place to start, because we're not now dealing with years of compounding compensations and bony changes that have already happened, and a nervous system that's been dysregulated for 10 to 15 years. So infants are still very complicated. You can't just, you can't just look at a tongue tie and say, oh, I'm just going to laser or snip that, or it's still not that easy. And it's not ever going to be that easy if you want it to be predictable and actually work. But it is less complex than the child and adult population.
Yeah. And that word compensation kept coming up for me when you were talking about what happens downstream to older people. So there are so many people I hear that say, well, I didn't breastfeed, but the baby breastfed just fine, even though you find that's high later. And then you go back and you're like, well, that was because you worked so hard, or this happened or that happened. And you and the baby compensated. And then we go into feeding, and we are making compensations in feeding with the types of food we give our babies who can only handle certain textures, and our toddlers and such, right?
Well, and as a society, we have compensated for it. We have made lots of processed foods that don't require a lot of chewing, and they have become very common. We always try to differentiate common versus normal, right? Mm-hmm. So it's very common for a 2-year-old to eat chicken nuggets in our society, but it's not normal that they can't chew a proper piece of chicken that's not in a hot dog nugget ground shredded form. Like that's not normal. But as parents, me included, no one's educating us. We're just seeing what everyone else is doing and what's out there, and we're making the best decision possible, right? So it's not the parents' fault because they are making the best decision with the education that they have. The problem is we're not educating them correctly.
Right. And how do we get to that place? This isn't a question I expect you to answer, but how do we get to that place that the parent, like, who does the parent trust to give them the information, especially if they're second or third generation compensating culture, that has, well, this is the way I was raised. And the grandmother is saying, well, this is what I did with you, which is what happened in my own life, and you're just fine, kind of. And then pediatricians, not to insult pediatricians. I say this all the time. There are wonderful pediatricians, but in general, they don't have the education that those of us who have taken this deep dive into oral structure do. They just don't learn about it. So parents are turning to pediatricians and their family friends, and then some random lactation consultant or dentist or, PT or CST provider starts talking to them about Airway and I don't blame the skepticism because
there are so many conflicting opinions out there, and I get it. Parents choose their pediatrician quite carefully as someone to trust, to guide them. So if they're saying something different than I'm saying, and I don't have that long relationship, it's difficult. But, I guess the philosophy I take in my practice is education. So you don't have to do anything about it. I tell people this all the time. You can live with a tongue tie. Right. This is not a life or death situation.
Right.
But it is going to compromise some quality in your life. And when I'm looking at a child and I'm telling a parent this, and they're saying something along the lines of, oh, but they're gaining weight, they're eating okay. I'm like, that's fine. Great. If you're comfortable with that, let's just monitor it. Here are the things associated. Mm-hmm. However, they are making up for the fact that their tongue is not moving properly. And a lot of times that's overstretching or overstressing the other facial muscles. And I said, you're not going to see the side effects of that now. But 30 years from now, that's when you start to get the TM joint breakdown. That's when you have chronic neck and back tension and headaches. Because 30 years of compensating, your body is not going to allow that without having some symptom.
Yeah, you're telling the story of my life.
I'm not the practitioner that is of the camp of a child comes in and I visually see a tie and there's literally no symptoms, no compensations. I am not of the camp of let's prophylactically release everyone's tongue tie.
Let's shout that from the rooftop.
That's not okay.
Yeah.
We can't just look at something and say, well, that is maybe going to cause a problem. Right. Let's go ahead and just take care of it now. That's not the camp that I'm in.
Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. Right.
What I like to do is say, here are the potential things that this can impact. You're at home with your kid all the time. I see them twice a year. I want this to be on your radar. You start to see any of these things, let's take a deeper dive. And what that deeper dive looks like is not a procedure. The deeper dive is therapy. Mm-hmm. And a therapist doing a full assessment and seeing, okay, is this just like a habitual thing that we need to now retrain? Or is there actually this physical tie that is causing a problem? Right. So it takes a lot from initial assessment to get to the place of procedure. We're not just like, okay, we see a piece of tissue, let's go ahead and do that. And that's where tongue tie release gets a bad name. Mm-hmm. Is when people do those types of things, because
they can have bad results or no results, and then
results is the thing that really bites us. Yeah, is because then the tongue tie release doesn't work.
Right.
Well, it doesn't work if it's not needed.
Right.
It doesn't work if we do it without therapy and looking at the whole body.
Right.
Yeah. So, and that is when people ask me about pediatrician stuff. Those are the situations that they have seen. Mm-hmm. So in their mind, it doesn't work. And I get that because that is all they've been exposed to. I feel like part of my job is to show them a different side of when it's appropriate to do releases, right. When it is appropriate, how to do it to actually get positive functional results. And that is how it's supposed to be done. But that takes time.
Yeah. And getting back to, for new practitioners listening to this.
Yeah.
On all ends of the spectrum and all initials after your name, it doesn't matter. We all started in that place. Like I remember, I just learned, you see something, send it to there was an ENT in my area that would snip it. And that was it. And some babies did better after, and some babies didn't, right?
Yeah.
That's how I started. And then started getting more involved with different people and networking. And this is what I suggest for new people, new into the field of, definitely get a community. Like we connected at American Laser Study Club. That's a beautiful community, great conferences that it's not even so much about what you're learning on the stage. It's about the talking during the lunch periods and the getting together and getting other people's opinions and making connections, both geographically or, where you can, have a study club with someone or, I have my insiders group where professionals can join, and we have once a month. We did
awesome.
A meeting last night, and it was lovely. It was someone who's a sleep expert, which we usually go, ooh, sleep, but I was like, no, we need to learn from each other and understand how this relates to sleep training, even though I don't love sleep training. It was a very educational experience. But anyway, making the connections, learning as much as you can, and then learning to find your people locally, which they do exist. Unless you're in a really remote location, there are definitely other people either at the same level as you or maybe a little ahead that want to get together, And
I also tell, dentists, a couple of things. One is I have learned so much from other disciplines. My chiros, my speech language pathologist, lactation. I didn't know anything about any of those disciplines. And it's just spending time with them, shadowing them too, the other thing is, as a practitioner, I lean on people that are not local, other dental practitioners that are in this field. You don't have to stay, obviously, if you're working hands-on with patients, staying within your community. But I run things by other practitioners all the time. You can create collaboration. And if you're in a place where there are not great lactation consultants yet that know about this, or body workers, if they're interested, learn together. Like,
absolutely,
teach each other, go to courses together. I will say, like, one of my greatest resources and partners is a chiropractor here in Houston, who she approached me, but neither of us, like, we knew about tongue ties, but we were not where we are today. And we just learned together. And we now lecture together, but we were going to courses together. And it's not that you're going to find the perfect person right off the bat. But if you have someone that's interested, that wants to learn, you start there, right? You got to start somewhere.
Yeah. And I have more respect for people who admit they don't know things yet and 100%. Are willing to learn than people who think they don't need to learn after they graduate from whatever school they went to. Because we don't learn this in school. I say this every day. No, I didn't learn this in school.
Even as we're learning it, it's changing. Yes. We're learning more through more people are doing it. So we have more data and your own patient experience. I certainly don't do a tongue tie release today the same way I did it 10 years ago.
Right. And I don't do preparation the same or even my education has evolved with what I'm teaching. Thank goodness we evolved our practices, right?
Yeah. And that is also one thing where I have met many practitioners that have been to several of my courses and repeated my courses, and they bought a laser and they still have not done a single release. And I tell them, I said, there's only so much you can watch me do this or watch someone else do it or learn about it in whatever book. The best learning you're going to do is by doing.
Yeah.
Don't be flippant about your training. Get good training.
Right.
Don't just go start doing things.
Right.
But once you've got the training, the best way you're going to learn is by doing.
Right.
So you have to start doing.
Yeah, that must be so empowering, because I know that when I was first, I worked in the hospital for many years. And when I was coming out of the hospital and into private practice, it was at a point where more and more people were learning about tongue tie and looking for someone a lactation consultant. And there were no lactation consultants in my community. There was one who worked in the hospital. She was like already a lactation consultant for like 25 years. And she was beautiful, but she was like, Lisa, I don't know about this.
Yeah.
So I went to some courses, and I'm fortunate to be in the local area with Dr. Scott Siegel. And I had a conversation with him, and I said, we had a mutual patient that I sent to him, and then I had a conversation with him, and I learned a lot from that. And I went to his office, and that networking, that in-person experience, that's important. And I said to him, I just still don't feel confident taking care of these babies. And he said, Lisa, you know more than anyone else in your area. And if not you, then who? Right. And I think that could work the same for the dentists that you're speaking to, who have that laser, who know what to do physically and are just afraid to put their feet in the water because it's scary.
Change is always scary. And when you do these things, but just like anything in the practice of dentistry, you can, get bad reviews about it. You can, you have to be careful about what you say and what you do. And especially in a field like this, where we're not all saying the same thing. The pediatricians are saying one thing, another dentist is saying another thing, the ENT is saying another thing. There are going to be people that don't like what you say. And you have to be ready for that. And it can be polarizing. I mean, we've seen there's, New York Times articles that come out about these things. So you have to be ready for those things.
Right.
But if you are truly doing it with the right education and to benefit the patient, I think it's okay. I think it's just the nature of the practice.
Right. And if parents feel supported in whatever suggestions you're making, whatever education you're giving, and feel like they are empowered to make the decisions for their own baby, I think that keeps us a little bit safer.
Yeah. And I think that's a really good point. Like, you should never push someone to do this procedure, whatever age they are, the infant or the adult that you're treating. You want them to make that decision on their own. And so that's where you get into trouble, is if you are pushing instead of just educating and saying, it's your baby, it's your child, it's your life, you make the decision. And that's where I draw the line. Like, I'm an educator. I'm going to give you the options. This would be why you should do it. These are the potential improvements. Ultimately, it's your choice. And it's not a decision that needs to be made right now, and that's interesting because we screen all of our patients in the practice, even the one that come in for wellness care. And so we'll talk about a tongue tie or a narrow palate or some sleep concerns that we're seeing, some grinding. And some parents, I'll say it and they'll jump right on it and say, oh my gosh, you're right. I've noticed that they're not a good sleeper and their behavior is starting to change. What can we do about it? Or there'll be the parent that says, no, they're fine. We're fine. They sleep well. Okay, great. Well, if anything changes, here are the things you're looking for. If anything changes, we'll check in at your next 6-month appointment. Or if you notice something earlier, call me. I'll see you earlier. I have had so many of that second situation. Sometimes 2 to 3 years later, they'll say, remember that thing we talked about? Well, now I'm noticing changes. Or I just got diagnosed with sleep apnea and I don't want my child to be in that situation. And so everyone has their own timeline and what they're ready for.
Right.
As a practitioner, I get it. It's hard. You see something, you want to fix it right away. Right. That's not your job.
Right.
Your job is to educate the parent and have them decide if and when they want to address it.
Right. Yeah. And also be able to point the parents to other people who are, I don't want to say teaching the same thing as you, but like are in the same camp. So you can say, listen, I didn't make this up. There's this whole organization that's doing research and you can go here and look at the research or, like listen to this person or listen to that person. Because I think that, or, if you have like in my case, if I have SLPs and different forms of body workers that I collaborate with, and when they go to that other person and hear from their lens, similar things from what I'm saying, but from the lens of a different practitioner, that sort of makes them feel more confident in what, in helping to make a decision. And sometimes the decision isn't, I'm going to do this right now, but at least they're aware of it. Like I like to call it anticipatory guidance for the future.
Yes.
Right?
Yes, exactly.
Yeah, it's beautiful.
It's very important.
Getting back to what we were talking about, like treating infants to prevent long-term. This is something we really don't have evidence for yet, right? I mean, like this is where I'm like, I wish we knew. And I feel like the complication there is that treating is so variable.
Yeah.
Right. So if we did a study and said, all right, here's a bunch of 10-year-olds, let's see how they sleep. Did they have a tongue tie release when they were infants? Who's better or worse or whatever? We wouldn't know what that treatment exactly was to compare it.
And I also think it's not that simple, right? Because, we give our patients a lot of anticipatory guidance, the ones especially that come in when they're babies or infants for tie releases, is we can do body work and lactation, and I can do a tongue tie release. But if you, after all that, go and stick a pacifier in your baby's mouth,
right,
feed them highly processed, mushy food, and, don't address when you notice if they're mouth breathing, they can still end up with a very poor airway, even though I treated their tongue tie.
Exactly.
So it's not just about, okay, I did this tongue tie release and now my palate's going to be beautiful and I'm going to breathe through my nose. No, there's a lot of other stuff going on. So we talk about, well, first of all, I don't allow pacifier use during the whole process. Like you're going through a tongue tie release, that pacifier's gone. Technically, can you introduce it 4 weeks after the procedure? Yes, but I don't know why you would, because you don't need it at this point.
Right. Yeah.
We talk about the importance of baby-led weaning. So when you're about to introduce solids, you need to go the baby-led weaning route. We cannot do pouches and purees. And when we are drinking out of cups, it's an open cup or a straw cup.
Mm-hmm.
There are lots of other things that can screw this growth trajectory up besides, or I should say, despite doing a tongue tie release. So that's where it gets tricky. What have they been doing in the past 10 years? What have they been eating? Do they have allergies? Are they sleeping with their dog in the bed?
Right.
And
not even the texture. What type of inflammatory foods are they? Are they having? And, are you having good sleep habits with your child, or are they just like watching screens all day and, whatever?
So where I stand now is a untreated tongue tie is not going to help your airway growth. So we know by releasing it, I should say we don't really have research, but through practice that a tongue that is working is at least going to help with good airway development. So doing a tongue tie release, in my opinion, can't work negatively on that.
Right.
Is it a guarantee that if you treat a tongue tie during infancy, you're going to have a good airway? Absolutely not.
Right.
So we can't say those types of things.
Right. And there are people who are saying it, which makes me a little nervous.
It's not that simple.
Yeah.
If it were that simple, we'd all be doing it all the time, but it's not that simple.
And then treating isn't always releasing.
Right. Yeah.
So then you could have a good treatment of a restriction, get good function at a certain point, but then may need further treatment down the line.
I think the statement more is a tongue that has full mobility, that is working well functionally, is a tongue that is going to guide an airway. Whether there's a tie release or a not tie release, or that is the tongue functioning completely.
Yeah.
That's really what we need to look at.
Yeah.
And then the question is, if it's not, how do we get it there?
Right. Depending on your age and stage of life and what the function is. What the
problem is. Yep.
Yeah.
Exactly.
That's a great way to look at things.
So I think what we've just looked at it as is, does there need to be a tongue tie release or not? Well, it's not that simple. It's the function, which is why I teach something called the function first model, because it's all about the function. It's not about the way it looks. It's not about anything else. It's about the function.
Right. And are your courses just for dentists, or are they multidisciplinary?
So the ones through the American Laser Study Club that we do it's a 2-day course, and it is about the function first model. But because the function first model is a team approach, I teach with a chiro and a myo and a lactation. So those disciplines definitely, but also a lot of the course is on the operational side, because the other thing that happens to us as dentists is we go to a course, we see this awesome procedural thing, and then we have no idea how to incorporate it into the practice.
Right.
We have no idea how to train our assistants or our front desk to support us. We have no idea how to bill it.
Right.
Ultimately, it has to make business sense for anyone to actually do it. Okay. So we talk a lot about that. So I have had many office managers and lead assistants come to these courses to help train the rest of the team, to help support that doctor do what they want to.
Right.
So no, it's certainly not for dentists. We've had a lot of repeat people where maybe the first time the dentist comes and then they bring their team the second time.
Right.
Or whatever it is. I also teach a 2-day early airway ortho course that is not through American Laser Study Club, but all the information is on their website. And similarly, it's about clinical treatment, but it's also about how to implement it into your practice.
Right. Because the business, and I'm starting to branch out into some business coaching as well. Because like you said, you can have all the information. If you don't know how to do this in your practice and make it,
you're not going to do it.
Then and set it all up and all that.
You're going to go back to the fillings and stuff that you know how to do predictably.
Right. Yeah. So I love that you promote interdisciplinary learning, because we learn in silos in our separate disciplines. And
Yep.
I've done some work. I've done some of the 2-day seminars with American Laser Study Club as well in my area. And I love that because it's so fun to speak to dentists as a lactation consultant and a midwife, because most of the people in the room either, and most of them are young, and maybe at the age of childbearing and, starting their families, and they've never even heard of a lactation consultant, or they do, but they don't know what I do, and that's just so fun. But even in my professional's guide to tongue tie, it's interdisciplinary because, and I get some slack from other lactation consultants because they're very territorial about teaching other people what we know how to do. But I feel like, first of all, most people never see a lactation consultant, right? Most people in the world will quit breastfeeding before they've found a lactation consultant.
Yeah.
And, just if we learn together, then we know who to refer to, how to refer to them, what their scope is. What's beyond their scope? Who needs a different kind of provider, right? I've had some of the best experiences at speech language pathology conferences. Learning from them, knowing what they do. Because I worked alongside one in the hospital for years and I had no idea what her scope was.
I think also what people need to realize is there are so many people that need our help. Mm-hmm. The more of us that do it, the better. The more of us that do it, the more awareness there'll be about it.
Yes.
So there is plenty to go around.
Absolutely.
There's too much. There's too much, Yeah. And so I think the sentiment really needs to be the more the better.
Right.
Bring more people
lifting
to this
each
party.
other up is only going to help the lifting of the profession, the lifting of the practices that we have, and the betterment in society. I think this is kind of I don't know, and I hope I don't insult anybody by saying this, but I know growing up in the different fields that I have, midwifery, nursing, especially, we start out with this almost like a hazing kind of situation.
Absolutely.
And, I was pre-med and learned alongside with pre-dental students. And this is going back 40 something years. Right. And it was like that then, who was cheating off of who and who was trying to be, and that against each other, that's ingrained in us. But I think really we need a more feminine lifting approach. What do you think?
Absolutely. Yeah, no, 100%. I have 2 practices in Houston, and I only employ women, and there are 27 of us. And it is amazing to support and promote other women. Some of these women are the IBCLCs and have their own practices. And I do think it's important that we're there for each other, to support each other. Honestly, there's so many other barriers already in place. We don't need one more thing. We just really need to help each other out. And that goes full circle, I love it. There are 2 practitioners in Dallas that we do the same type of work. And we have had patients that live closer to them contact us and vice versa. And we tell them, no, go see they are 10 minutes from you. I am 4 hours from you.
Right.
And I love that. I love that collaboration and that support of each other and that mentality of, I don't need to keep everyone for myself. At the end of the day, what is our mission as practitioners? To do best by our patients. Mm-hmm. And that is not seeing me 4 hours away. That is seeing the other awesome practitioner that is right in your backyard.
Right, right.
And I think we need to get out of our heads.
And those practitioners will refer to you then, who are patients that are closer. And I have that kind of relationship with the lactation consultants in my area. Even among what we like to do. There are some providers,
personality types,
IBCLCs that are good at helping people use an SNS. And I'm that's not my thing. I'm not a flange fitter. There are some people who are, and who likes their, what niche fits best. And that's who you send the people to. Go to the person that can help you best.
I think it takes getting to a certain comfort level in your own profession and your own, honestly, in yourself, and knowing and that's when, you can honestly say, I'm not the best at that.
Mm-hmm.
That doesn't make me a bad practitioner. It's just not my thing.
Right.
And you're not afraid to say, go there. Right. But I think when you're new, you're in this mode of trying to prove yourself that you lose sight of that.
Right.
And I think some of that just takes time and maturity.
Yeah.
But
wisdom.
I think modeling that behavior is the way we get other people to do that as well.
Right. Good point. Because if somebody gets a call from someone who says, Lisa sent me to you because she said you're good at flange fitting and she's better at doing whatever. And then they'll get that in their head. And we have there's quite a few lactation consultants around here.
And I do feel that
each other.
In the Airway space.
Mm-hmm.
Like I do feel that we are all like at these big, at the big conferences, the Breathe and Thrive, we are all truly there to learn from each other and support each other and bounce ideas off each other so that we can all thrive and treat more patients and do it the best that we can. So I love that sentiment when I go to those conferences. Like it feels really good to be around those people.
Yes.
And feel supported and support them. And I'm hoping that just continues to grow. Yeah.
And there's also ICAP, which is amazing too, which is like the other, it's a different, a little different lens because one is based on the laser and one is whatever, came differently, but still the same mission of collaboration. And you just feel so good after a conference like that, right?
Yeah. Yeah, absolutely.
Like people always say, so where are you going now? And I say, it doesn't matter because I'm not going to leave the hotel because we just have so much going on with the people we're with, but So awesome. Dr. Gandhi, thank you so much for giving us your time. I know you're very busy with your kids and your practice and your teaching and all that. And I totally appreciate you coming on today and giving us this time to help other people understand how this can be done right and how we can empower our patients and other providers. So thank you so much.
Thanks for having me. And if, Lisa's going to put some of my contact info on there, I'm always happy to chat and answer questions or, if you're in Houston, even better, would love to, collaborate. And thank you so much for having me.
You're welcome. And I'll put the connection, your website in the show notes, but just say it in case somebody's driving and they don't want to look at their phone.
It's www.westupediatricdentistry.com. So the practice is called West, the letter U, Pediatric Dentistry. And our other practice is Tanglewood Pediatric Dentistry. And they're both based in Houston. So feel free to reach out, follow us on Instagram, and we'll hopefully be able to chat.
Excellent. Thank you so much. Have a great day.
Have a great one. You too.
Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Have you ever wished you could help that mom who is questioning if she has enough milk? Ever wanted to either reassure her or know when to refer? As a lactation consultant, I created the program Understanding Milk Supply for medical and birth professionals to help you to feel more confident in those exact situations. This affordable, recorded video mini course is open to anyone who works with pregnant or breastfeeding families. It's a particularly valuable opportunity if you're an SLP or an OT who wants to gain an understanding of how breast milk is made, or a dentist in the field who is often the first-line provider for tongue-tie treatment. The function of the infant at the breast depends on milk supply. Even if care of the mom isn't in your scope, there are basic principles that you can learn that may rescue a family's feeding goals. In Understanding Milk Supply, I teach you what red flags to look for, when to refer, who to refer to, and how to advise the family in the meantime. And there's one LSERP included for lactation professionals. Go to www.tonguetieexperts.net/milk supply. The link is clickable in the show notes. And as always, you can use coupon code PODCAST15 to save 15% off this and all Tongue Tie Experts courses. Thanks so much.